Okay, so I think we'll begin. Thank you so much, everyone, for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is a special collaboration between the Blum Center and Mass General Substance Use Disorders Initiative. Before we get started, just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you can visit the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has been muted so that we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them. Only Blum Center staff and the guest speakers will see your questions. Please do not share any personal medical information or questions in the chat box. If you have a personal medical question, please ask your doctor. Okay, so next, in recognition of National Recovery Month, I would like to introduce you all to Winia Rodriguez. She is the program manager for the Recovery Coach program, and she will kick us off and introduce you all to our guest speakers today. So I'll hand it over to Winia.
Hi, thank you, Amy, and welcome everyone to, again, removing barriers while remaining resilient in one's recovery during uncertain times. My name, again, is Winia Rodriguez. I'm the program manager for the Recovery Coach program. I'm also a woman in long-term recovery. And for me, that means that I haven't used drugs or alcohol in almost 10 years. I'm so glad to be here with my colleagues on the last day of National Recovery Month. And this is just going to be a part of a conversation with the three of us, with the four of us, I should say. And we have coaches working all across the MGB system. We have coaches at Brigham and Women's, North Shore, Newton Wellesley, and Pentucket Medical, and of course here at MGH. At MGH, recovery coaches are non-clinical team members and in many different multidisciplinary teams, such as primary care settings, our bridge clinic, where people can access low threshold medically assisted recovery, the Hope Clinic for pregnant and postpartum moms and their families. And we also have coaches working with healthcare for the homeless as part of the street team, 2 coaches working in the ED, and a coach who works with young people 26 and under, coaches who work for the addiction consult team, and coaches who work at West End Clinic and also Bullfinch. So we are very widespread here. They use their own lived experience to remove barriers and be an advocate and support people on their journey through the challenges of substance use disorder. They utilize tools such as harm reduction, introducing people to multiple pathways of recovery, and motivational interviewing. The pandemic posed unique challenges for everyone here at MGH, but particularly for recovery coaches who had the flexibility to meet with people in the community, and of course that had to change. Without further ado, let me introduce our coaches. We have Ryan O'Brien, Donna Aiello, and Dan Foley. Today, they'll be sharing their experiences on how they remained resilient in their own recovery, challenges they may have faced, tools that they used, and how they translated that into their work. So we're just gonna go around the table and each of them are gonna introduce themselves and let everybody know where you work.
Great. Hey guys, good afternoon. My name is Ryan O'Brien and I am a recovery coach in Charlestown at Mass General. I've worked in the field of substance use disorder for about 8 years, and I'm a recovery coach, and I'm also a licensed alcohol drug counselor. And I'm glad to be here. I'm glad to have everybody here, and thank you for helping us celebrate Recovery Month. Thank you.
Hi everyone, I'm Donna Aiello. I am a recovery coach here at Mass General on the main campus. I work the addiction consult team inpatient. I also work the West End Clinic outpatient. I've been in recovery for 11 years now and been working in the field for a little over 6 years.
Thanks, Donna. Dan Foley, I am a recovery coach for Mass General. prior to the pandemic, I was working at the Nashua Street Jail as a recovery coach, but the pandemic, with all of its challenges that it threw at us, I segued into working in the emergency department here at Mass General, where I'm currently working as a recovery coach and peer navigator.
Thank you. You're all amazing coaches. So I'm just gonna jump right in with a couple questions, and it's just gonna be a conversation. So I wanna know, how was your recovery and your work affected by COVID? When this first hit, how did you, what were your thoughts? What happened? And anybody can jump right in.
I'll jump in. So working for the West End Clinic, this new Clocks One space, we were moving here with the Bridge Clinic. We moved in here on Monday, and we were all asked to leave and go work remote like everybody else pretty much on a Thursday. So we're like, all right, we're gonna do this for a few days. Well, a few days turned into still, West End Clinic is working remote. With the addiction consult team, because I have a split position, I work both inpatient and outpatient. So working from home for the addiction consult team inpatient proved to be pretty challenging. Trying to call patients bedside was extremely difficult, not, having them answer phones or have cell phones or pick up phones. So that posed to be quite a bit of a challenge for me, learning to adapt my work while managing my own recovery. So my work life was challenging. How do I physically manage my own recovery? Trying to figure out where there's still open meetings when the world was pretty much, after we got sent home, the world got shut down in 2 weeks. So where are the meetings for me? Where are the meetings for the people I'm working with? What's happening with work? It was pretty isolating, and the worst place for me to be as somebody that's in recovery from alcoholism is to be isolated in my own head, no resources. My family's, we're all segregated. We're not, what do? We're not with each other. So that in itself was, Dan's at home. What I call Dan, I call, right, what do we do? We're calling each other, like, how are we managing this, right? It was pretty tough, and I'm sure it was pretty tough for everybody. For me, I was lucky because I had this great app called In the Rooms, and I was already utilizing that online forum for probably 1.5 years before the pandemic hit. So that really, really, really saved my life, saved my recovery. And for me, what I did was I just kind of went with that regular routine after a weekend, and the shock left, like, oh crap, we're gonna be working remote for a long time, figuring out what happens, if things are gonna ever get back to normal. I would go for my morning walk. Like, I would pretend I was going to work. I'd be out, I'd go for the morning walk and my commute, and from home, do what I would normally do to get ready for work. And I would listen to a meeting in the morning, because that's what I needed to do. I needed to keep my head where my feet are at and stay grounded in my own recovery, because I wasn't going out to meetings. There weren't any. And so using all of these tools that I was adapting for my own recovery, I had to quickly learn to use in the work that I was doing with the patients at the West End Clinic, saying, hey, this is what I'm doing. With the patients I was calling on the addiction consult team, like, hey, can I help you navigate this? Do you have a phone? Do you have access to any type of computer? And so it posed some challenges, me figuring out my recovery and trying to help the folks I'm working with to figure out their recovery.
Does anybody else want to share about how your recovery or your work was kind of affected? I know, Dan, you couldn't go back to Nashua Street, so I know that was a huge challenge.
Yeah, just similar to what Donna shared. I was at work one day at the jail, and at the tail end of that day, I found out I was no longer welcome to return because the Suffolk County Sheriff's Department wasn't going to allow civilians into their facilities out of fear of bringing the virus in and putting the population in danger. So I had to figure out how to adapt a role that was in person and in an incarcerated setting to working remotely, which was interesting to say the least. It did afford me the opportunity to try to follow up, focus my efforts more on following up with individuals that had been released, which was wonderful, able to try to connect them to resources. It was a big challenge trying to get in touch with them, but I found creative ways to get in touch with them. Had a lot of conversations with family members of theirs because of the phone numbers they did have listed. But then I got a great suggestion from an individual that was currently detained through the pandemic. He had reached out to me via his caseworker, who contacted me via email and asked if I could write him a letter. And once I got that email, I said, this man is a genius. And I then spent half my day on the phone and half my day writing letters to all the individuals that I knew were currently detained. And that in and of itself was very powerful for my own recovery, just because I was in a situation where I was putting pen to paper and writing my feelings in regards to the struggles I was having with my recovery, and staying connected to human beings that I know were in not the best of situations. They had a lot of in your cell time at that time. So the letters were very meaningful, both what I sent and what I received. So I'm really grateful for that individual, who goes by Jack, for having that suggestion. But then through the course of the pandemic, the emergency department didn't stop, and I have experience working in that setting prior to coming to Mass General. So it was kind of a natural segue to help out where help was needed. And I then started working in the emergency department and was back to the face-to-face interactions, while still trying to maintain those relationships with the individuals that had been released. And unlike Donna, I was not well versed in digital formats for recovery meetings. So there was a very hard, fast learning curve for me to get familiarized with the Zoom meetings, the digital formats. But I feel as though I picked it up somewhat quick, and that was really great for me to be able to stay connected to my coworkers, as well as my support system that's been in place for the last 5 years. It's worked so far in my personal recovery from substance use, and to have that fall to the wayside could have been very tragic in regards to my personal recovery. So I'm grateful that the digital formats made recovery resources somewhat more accessible in some ways. If someone had the access to the technology needed to get to them, was what the biggest barrier for the participants that I encountered. It sounds like you, and I assume you had run into that as well.
Absolutely.
Yeah, it sounded like everybody had to kind of adapt really quickly. Ryan, if you want to talk about.
Yeah, I mean, I would actually, nice to see everybody in, and thank you for joining us. As far as, how is my work and recovery affected from COVID? It was immensely. There's a term called a sea change, and, a sea change takes time, and, in my personal recovery and my personal work and my personal family life, I did not adapt that quickly. It took a couple of months. I had, I had kind of lost myself as far as not realizing how much I had depended on person-to-person contact until one day I came to work and that was taken away, and I could not, see family members. I could not see participants I work with. My kids were now homeschooled, and now I'm just, one day being a person of the community in Charlestown, 1 square mile, you know what I mean, going from place to place, working in 3 different areas of Charlestown, the Crossroads, Tough Street, New Health, and the Health Center. 2 of those places still closed, the Health Center now open. Just amazing how being part of the community was taken away, meetings taken away, in-person meetings, absolutely resistant to Zoom meetings at first. I wasn't ready. And I would go on them. And, being a person in recovery, I suffered. And, we can get into the tools in a minute, what did help. But, I had to, on almost like a, prodigal son type thing, where I had to become who I'm not to become who I am. I had lost myself and had to find who I was again, through my personal recovery, how to adapt virtually, how to adapt virtually my kids' schooling. It was really, 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 it was tough for me. And I'm talking a number of months before I really readjusted. And, and that's just as real as I can get with it, but, here I am today feeling pretty good. So, yeah.
Yeah, thank you all for sharing that. I know I'm an introvert and I adapted very well. I was like, we get to stay home. This is great. All for it. So yeah, it wasn't good, but it affected me too. After a while, I really started missing people, and one of the biggest pieces that I've realized in my recovery is that I need that fellowship of other people in recovery, whether it's visiting a recovery center, going to a convention, some kind of recovery event, and I miss that, and I still do. And so Donna and Dan, not Dan, Ryan, you all brought up, you all brought up tools. Do you want to share any tools that you use?
Sure. Yeah, many. I had to find new tools, and for me, it being a personal person in recovery, I relied on a spiritual aspect, and that spiritual aspect came from me not being able to go to meetings as part of being, the GOD acronym of the great outdoors, and my kids being in school, taking them out to, Walden Woods, taking them out hiking, taking them out into nature, and, realizing that is an important part of my recovery too. It's not just person to person, being part of the world, part of the, enjoying the sun and enjoying outside. And there were some benefits to COVID too. And for me, it was like, I represent multiple paths of recovery and as a recovery coach, but I kind of lost myself so much that I tuned into the program of Alcoholics Anonymous. And I wrote what was called a 4-step, which is basic inventory of who I was, where I needed to be, and where I needed to go. As a person, and I was dealing with fear, I was dealing with resentments, and I put all that, like Dan said, pen to paper, and brought that to someone I call sponsor, and did a 5th step, and kind of just, basically dropped, all this weight, extra weight I was carrying, not this weight, spiritual weight, which is just as heavy. And for me, it's just like, I had to look at like who I was. I was alone. I wasn't connected with my higher power, and it just, and some of the stuff that came about was, once I did the 4th and 5th step, I started to feel a little bit better, and I reconnected. I think everything happened for a reason. And the fact that our facilitator here is named Amy Sam, and he's talking about, a friend named Jack who helped him in jail. For me, it's like my girlfriend has been, nothing but a powerhouse as far as being standing in my corner. Her name's Amy, and my 2 sons and a single dad is Sam and Jack. So I just find that very funny. And for me, it took time where once I learned to find myself, realize what I was doing, and reconnecting with participants, and adapting to virtual meetings, and connecting with people FaceTime, phone calls, and eventually get to go to their area and meet people. So I was going to Peabody, I was going to Lynn, I was going to, back into Charlestown, meet one-on-one, that kind of stuff. And then also kind of seeing the light of what I need to do as a single dad. And I looked into the courts and got, went through the process of getting full custody of my 2 sons. Took a number of months until about December of that year. But like I said, I was pretty lost, and, started to be found through, for me, the program Alcoholics Anonymous in that time. So it was just, it was a lot, man. So it's good feedback.
Well, congratulations on getting custody of your son.
Yeah, absolutely. It was quite a project. Always through Zoom, and it was all through. Yeah, it was quite the ordeal. And but I realized it was something I was not. It was time to step up. And for me, I had to get lost before I got found. And that's just the truth. So
awesome.
Yeah.
Thank you. Anybody else want to share any tools that they've used? Donna, you mentioned in rooms, which has been an online tool for many years.
Yeah, that's been on for a while. But I came back to the hospital. I came back inpatient to work in June, so I was only out, a short period of time. So for me, coming back to having face-to-face connection was fabulous. I craved that, and I live with some family, not all of my family. So I wasn't quite out of the loop and as segregated as maybe some others. Still don't meet with West End Clinic, folks, because it's hard to make appointments in the community with them, because they're pretty much scattered. But being back here was a great tool for me to be around my colleagues, to be around patients in the hospital, you know, complete PPE, of course. And that tool in the rooms it's a huge sample platter for anybody that doesn't know it. I suggest to get familiar with it. Being a sample platter, there's every modality that we as recovery coaches promote is on there. It's just not your typical AANA 12 step. It's smart recovery, it's DAMA recovery, it's codependency, it's A to Z, there's everything there. So that, again, anything I wanted was on there. I didn't have to go far to look for it. I didn't have to, and it's not like the Hollywood Squares like we're on right now on Zoom, right? You know, it was one person, the chairperson speaking, and then just one person. So I don't have to worry about blocking myself out, go around, getting ready for work, doing whatever it was that I was doing, and I could just tune in. And the beauty of it's global.
Yeah.
So all around the world recovery, right?
Yeah.
And there's a meeting from 6 a.m. to 1 a.m. So whenever I'm feeling, you know, a little swirly and I'm not feeling right with the world and I have a break at work, I'm putting on a meeting.
Yeah.
That was really my greatest tool that I used. Went out for a walk in the morning. I tried to stay as physically active as possible. At the end of my day, I packed up my work stuff. Now I'm working out of my kitchen table, right? Because I don't work from home. I don't have a home office. So, you know, I pack it all up, put it in the corner, and I put my sneakers on, I go for a walk because I got to shake off the day, right? Because this work is hard. It's difficult. Now we're struggling and the patients we work with are struggling.
Yes, absolutely.
And it was almost like Armageddon when this hit, right? Because everyone picked up.
Yeah.
Like all the patients I work with, like, oh, I didn't know COVID hit. I didn't know what to do.
Yeah.
So everybody drank and started using again.
Yeah.
So now we had a pandemic within a pandemic,
Yes.
you know? So I scratched my head and I'm like, oh my gosh. And what I was kind of out of ideas for people, except for, again, sharing what was working for me, but also like, I don't understand if you have a program, right? How does this happen? So I can relate to Ryan, but I can't relate because I'm like, I don't understand how this happens. We have this program.
Yeah.
How do we go from here to here?
Yeah.
So it's so different how Ryan and I have been friends for a long time, but it's just so different how we have this different perspective on recovery, right? So what works for me is clearly not working for you and vice versa, right? So
I wasn't ready, but as I got adjusted to Zoom meetings, so exactly what Donna said. Next thing I know, I realized that there was some magic to attending a meeting in Ireland. I spent 7 hours one day in East LA Narcotics Anonymous meeting, talking about the history of Narcotics Anonymous in East LA, how it started with, you know, a couple of gang members and homeless guys under a bridge, and how it's expanded into this huge stronghold of Narcotics Anonymous in the, you know, the tough area, Compton and all that kind of stuff, you know, East LA and all that kind of stuff. And it's just, there is some magic to that I can tune into to a meeting in Scotland, and, you know, it took time to me to realize it, but, you know, when the student is ready, the teacher appears. I guess they still say that.
Yeah, I mean, it's almost like, you know, you can get away without having to pay for it. You know, get these experiences. Dan, do you want to talk about some of the barriers? You talked a little bit about, you know, the barriers of not being able to go into the jail, but do you want to share about some of the other barriers that you face?
The biggest barriers for me personally was probably the isolation. I lived with my wife and 2 children. They were ages 3 and 1 at the beginning of the pandemic, and it was great to have that time with my family, but it was a big barrier for me personally to be kind of isolated from my people, my supports. But learning about like the In the Rooms app, I'm pretty confident that you actually shared that with me real early on in the pandemic. Anybody that knows me knows I'm a recovering everything addict, and I tend to treat my recovery very similarly in that I explore everything I can. I don't say no often in my recovery. So the In the Rooms app was great because it let me explore paths in recovery that I hadn't been exposed to because they're just not in our area. Life Ring is the first one that comes to mind. It's mainly on the West Coast of the United States. And it was just amazing. And I, like Ryan, I was able to connect on different levels with different groups of people. And I'm not a very well-traveled man, but I feel like through those meetings I am now, because I was all over the world. It was interesting to see that different cultures all over the world have similar struggles. And, you know, it really helped me to get out of my head. But the barriers as far as work were, it was really challenging. A lot of, like, when somebody gets detained in a you know, incarcerated setting, they may have a phone when they get booked in, but by the time they're getting released, that phone's no longer active. So trying to get in touch with them was really difficult. And then if I was able to track somebody down, getting them connected to the resources that might benefit them was even more difficult, because they were typically borrowing somebody's phone to reach out to me. Every individual I met with did have my phone number. And it was really powerful to see how often my phone rang through the course of my time working from home. And even now today, from individuals that got out, it happened way more often once the pandemic hit than it did pre-pandemic. And I think it's because most individuals that got released to a different feeling in society. They weren't able to connect to what they typically would have connected to. And they were kind of living in a bubble inside the jail and not realizing how things had drastically shut down on the street. And so trying to get them connected to the resources they needed via technology or doctor's appointments, it was challenging, but luckily, we had some fast-thinking people here at MGH, so they were able to adapt the bridge clinic to telehealth. So as long as the individual had a phone, they could at least get connected to some form of support via medicine or recovery coaching or social work, whatever the case may be. So it was a lot of thinking on your toes and just figuring it out as we go. But I think all of us coaches, that's kind of our blueprint for how we do our job, because we don't go into any interaction with, I don't have a goal. It's about what is this individual's goal, and then it's brainstorming how to get them to where they want to be, because where I want to be, it could be inherently different than what anyone else wants to be. So
Absolutely. Does anybody else want to chime in about barriers? I know one of the things that I faced is transitioning here and then realizing that people needed to get their recovery coach certification, but there were no trainings. That was like really hard for some people too. You know, they're now picking back up trainings, but that was definitely a barrier for people who are in recovery, wanting to get their recovery coach certification, but they couldn't because of COVID. And people got discouraged. Some people said, well, I'm going to go find a different kind of job or go to a different field. It's been hard to hire people who have gone through the Recovery Coach Academy, because there is no Recovery Coach Academies until like recently. I know at, where you volunteer, you had some, but it's been tough for people, you know. And then there was Recovery Coach Academies, but they were really expensive some places, you know, and those are barriers for us being able to hire more people or hire the right people, and then being able to help the population that we serve.
I think some positives that have come out of COVID is the telehealth.
Yes.
I don't think telehealth is going anywhere. I mean, who doesn't love staying in their pajamas, meeting with their physician? You don't have to pay for parking. You know, you don't have to be late, right?
Exactly.
You're like on time, click on a button and here you are. I know I love telehealth. So we were able to, due to a grant, MGH was able to provide some tablets to folks to connect them to telehealth. That was huge. I don't know where we got the grant, but thank you, Elizabeth, for figuring that out, because that was just unbelievable. We also were able to send people to sober living on another grant. And another thing that was just huge for our folks, because it's bottleneck. There's no place for people to go. People were living in a tent, and there was also another organization that were giving people cell phones, again, to connect to coaches to telehealth because people just weren't meeting in the community because of COVID and there was no vaccine yet.
Right.
So there were some positives, I think, that came out of COVID. Not a lot, but you know, there were some.
Yeah. I find a lot of blessings that came out of COVID too. I think what I wouldn't have shared it if it was, a detriment. I think what came out of here is that, I come from a clinical background, working as a recovery coach, we meet people where they're at. And I think they have appreciated that. I told about struggle and things like that. And for me, not being able to adapt to the virtual platform right away, but utilizing it through asking for help, imagine that, in the health center and getting set up with my own Zoom meeting on Thursday, which would be, at 1:30 today. It's about a year ago, I opened up for my participants and we've been meeting virtually. And it's funny because before COVID, I had in-person meetings. And when it rained, or if it was if it wasn't a perfect 71 degrees, and a picture for Norman Rockwell, blue sky, get one or two people. But now we have quite a few handful of people, and we have and they can show up in any and all kinds of conditions and weather, and it's a beautiful thing. So this is definitely being battle tested and coming through this. I think they like as recovery coach that we're not here. We're eye to eye, and we go through stuff, so I think it was kind of a good thing for me, and I see a lot of blessings in it, and it's just, I'm a little disappointed we couldn't wear pajamas here today. But other than that, I'm dealing with this.
I do want to acknowledge that we did lose a lot of people during the pandemic. Not to bring the tone in the room down at all, but I don't think it would be fair to say that it was sad too, losing a lot of people. And we also had to deal with a lot of that. And thankfully for one of our coaches, Katie Raftery, she set up a Zoom link for us, right? Katie's on the wall, she's still with us, that we could meet 12 to 1, 3 days a week. It was just a drop in. And I think that was so helpful. I can speak for me. It was so helpful for me just to know it was there if I was having lunch, or just be like, click on and I would see a coach. Anyone was there. Ryan, Alan, Nick, Katie, anyone was there. And I think sometimes my calendar comes up and reminds me that, I don't know if that link is even still there, but I still see it on my phone, just as a kind of reminder to me that that was there for us. When we needed it. And there was a lot of times that I needed that, just to be, even if it was Zoom, to see Raina's face, to have you guys there, and then to meet with us personally once a month, to have our recovery coach meeting, and hold that safe space for us to be able to share our frustrations as a group. An MGH coach meeting. Those things were big too for us. Some more positives, because this work is super hard. We work with a really hard population that is really struggling. So trying to remove our own barriers and stay resilient in the work and bring that to the people we work with can be really frustrating. And how do we keep ourselves going?
Yeah, I can 100% relate. I'm truly grateful for the support that our team provided to myself, to each other, really. It was, looking back, it was a really difficult time. I lost a lot of people in my personal life due to substance use, and there's no way I can't draw the line directly between the pandemic and those losses. It just coincided too heavily, and to know midday there was a spot to go, and I know there would at least be one person in there to talk to in that Zoom meeting that I knew personally that was going through similar struggles was very, very helpful. So yeah, I do agree. I do think our team, even though we're in a variety of settings and we don't typically see each other often, the pandemic brought us cohesively together, and we had to fight through something much bigger than ourselves, and had to support each other in figuring out how to translate in-person jobs to remote work. And I know I wouldn't have been able to figure out the technology piece without the support of my colleagues. It was really a wonderful team building exercise. And then the one thing I do miss about the pandemic, though, absolutely, is the lack of traffic. Driving in during the pandemic was great.
I took the train for the first time. Since COVID. I know. awesome.
I miss that too. I
Yeah.
miss like, it was like tumbleweeds in the street.
Yeah.
I miss that
Yeah.
quietness, you know?
Yeah, there's a
Yeah.
blessing there. And what Donna said too, as far as the, the pandemic, inside a pandemic, that's huge. That's huge
Yeah.
because
Yeah.
there was a time, like Dan said, there was no way to contact some of the participants. I'd reach out by phone, but if they're living, on Mass and Cass and inside the tent, which is some of our reality, it's how are you gonna reach them? And we did lose some people because of that. And the fear of COVID itself.
Yeah.
At first, I mean, maybe not as much now, but I was going to the health center with no laptop and I was like, I was scared they're gonna die, because I just didn't know, didn't have that information that we could be safe and,
Yeah.
it was just a lot, man, so.
Yeah. I mean, everything that you all shared and, including myself and the topic of resiliency and remaining in our own recovery, like, I don't want to always make it seem like, oh, being in recovery is just like, we're gentle, fragile people, but at the same time, we're gentle, fragile people, and you all know when I came on the team, like one of the things that I do for our group supervision is I do a 5-minute meditation,
Yes.
just so we can start to practice and model self-care, because that 5 minutes or even those drop-ins are important to our recovery. The tools that, like some of the tools that I've used in this recovery, and one of the things that I love to do is roller skating. I fell really hard the other day, but we won't talk about that. But I love,
I happen to have a video.
I love
There's a lot live on that a lot of times.
Segue.
But I love to roller skate, and I go with my kids and we have fun, and it's safe. It's a really fun activity. I've picked up my love for roller skating again. I love yoga. Like when I'm stressed, if I go roller skating, I like all that stress just kind of melts away, so that's a tool that I found through this pandemic, like that love again for skating. And of course I still do my yoga. I do a lot of like self-care stuff,
It's our next year's recovery coach outing is gonna be roller skating.
that can be fun.
Excellent.
Yeah,
Okay.
we, as a team,
Team building.
as a team, we went to a lake for our recovery coach retreat. And so that was a tool for us to kind of get together, be outside.
Meet in
kayaked.
person.
Yeah, meet in
Yeah.
person.
Swimming.
I
Hi,
kayaked
who are
for the
you?
first time.
Yeah.
So it was great to have these tools available to us and to find new things, so that's one of the things that I found in the pandemic is finding new things, new activities, new people to get in contact with. So I just want to pivot a little bit. There are some questions. Amy, I don't know if you can either read the questions.
Sure, happy to. So we have a question that came in. In your roles as recovery coaches, has it been difficult to refer folks to different treatment facilities if needed during the COVID pandemic?
Yes, I'll answer for the group. It's
Yeah.
been incredibly difficult to refer, especially to the inpatient treatment facilities, but finding outpatient facilities that are operating in person, which tends to be preferable for a lot of people, has been incredibly difficult. There seems that a lot of the facilities had a lower capacity so they could afford for social distancing, but they're also dealing with a current staffing shortage, which reduces the number of patients they're allowed due to the nurse to patient ratio. And it's still an ongoing difficulty to make those referrals.
Yeah, that's been one of the most challenging things is, like Dan said, things are cut in half basically. And even there were some facilities and some detoxes and other residential that have closed down. Some closed down, some reopened, but it's been very, very sad to see.
And currently, we're dealing with outbreaks of COVID in detoxes, which will shut down admissions for up to 2 weeks at times for an entire facility. And yeah, I think there's 2 facilities right now that, like, in this moment that aren't accepting admissions because of something like that. So it's, good question and very challenging, yes.
One of the things though that did come out of COVID was, I guess they made a federal change to how people get Suboxone. So that was
Yeah.
something that was helpful. You know, people didn't have to go in person to have that first initial visit. They could do it through telehealth and get the medication that they need. So that was helpful, but actual inpatient treatments was shut down.
Well, I wish they would have done that with a methadone intake, but they didn't change that. But they did do take home, so that was helpful.
Yeah. Another question?
Yes, thank you so much. What resources have you found to be the most helpful during the COVID pandemic for folks struggling?
Maybe the simple resources as far as myself has been, my relationship with a higher power, my relationship with my family, my sons, my girlfriend Amy, my sponsor Matt. That's my personal. And as far as resources with my participants, it's been difficult, man. It certainly has lightened up quite a bit. There are beds opening and things like that. For me, it was more just, getting that first chance to go into their community to meet them was a huge way to empower them. And I just found that myself as a resource because, they were looking for the same thing I was looking for, which is that, they didn't want to talk on the phone anymore. We got a green light about 3 months in, 4 months in, that we could go to another community. And that I found really, really big. And, but it's just, it's been tough. It's been tough. Even today, it's still tough to, it was supposed to be, resource guides and, hey, can you help me get into detox? Well, no, obviously wouldn't say it like that, but it's tough. It's tough. So I find reaching out to, others and, utilizing fellow recovery coaches that very helpful.
Yeah.
I don't know that I could say which resources have proven to be the most valuable when someone's struggling, because it's always so situational in regards to what the person is struggling with in that moment, as well as their needs and belief systems. I will say, like when Dia mentioned, the initiation of Suboxone via telehealth did prove to be very, very helpful, especially with the population that was getting released during the pandemic. I saw quite a few individuals utilize that with great success, but it's so situational. I couldn't say which was the most valuable, but I think that being said, I think my fellow recovery coaches, I would have to say, would have been the most valuable resource for me to navigate those situations, because I know I can call Ryan, I know I can call Donna, I can call any member of our team. If I don't have an idea, I can explain the situation and it'll be on the tip of Donna's tongue, on the top of her head. I just haven't encountered it yet, or with Ryan. So, not really an answer to your question, but that's what I got.
Another question, Amy? Any more?
Yes, actually, I wanted to piggyback on that. I mean, recovery coaches, you are a tremendous resource. So my question is, how can one enroll into the recovery? Do you have like a program where someone can enroll in, and how can one enroll in it?
To become a recovery coach, take a training, or to get
To work with-
services
To
a
work with
recovery-
you, to get, support from you.
Oh. There's a lot of different avenues. So it's a little bit, we had this question come up from another presentation. It's a little bit difficult. If somebody has like a primary care doctor at any of the health clinics, right?
Sure.
If they can get into Chelsea, Charlestown, Revere, is that it? Or IMA?
Yeah, both.
Bullfinch, if they want to get, they can probably have access to a recovery coach that way. And then Donna works on the inpatient.
So Kristen and I work inpatient, so the ACTS team, if somebody was to come through the inpatient service and we were recovery coaching them, there's a chance that would be able to work with them a little bit outpatient as well. And then through West End Clinic, I would be a recovery coach for them if they wanted it. But to be with West End Clinic, you need an MGH provider, so a PCP and or a specialist through the clinic. And then, DM works through the ED, so that's a long shot for him.
If a patient comes in through the emergency department and they are struggling with a substance use disorder, I can provide some short-term motivational interviewing and resource navigation, and through the new grant under which Monique and I are working, we can also offer and provide HIV, hepatitis C, and syphilis testing, and we'll also follow up with the individual regarding those results and navigation of services as needed for the results. But so from what I'm hearing, it sounds like if you're connected to an MGH provider, it's possible to get connected to an MGH recovery coach. But if the question is more broad stroke and you're asking how any individual can get connected to a recovery coach outside of the MGH network, there's many ways to go about that. If you go to a peer support center, of which there's going to be 15 or more in Massachusetts.
26.
I said or more. So 26 of in Massachusetts alone, they can get you set right up with a recovery coach. There's also outpatient providers that you can walk in and just request recovery coach services. So there's many ways to get connected to a recovery coach, both in and out of the MGH network.
Yeah, and there, I would say for two kind of special populations, I mentioned it in my intro, in the Hope Clinic for pregnant and postpartum women, they can get connected right to the Hope Clinic. We're actually hiring for a recovery coach in that clinic. So that they can get in through the Hope Clinic, or they can get in through the Bridge Clinic, where people are offered medically assisted recovery. And there's a recovery coach that works there. It's kind of short term too, because it's a bridge clinic. It's just a bridge you to the next step. And then the other special populations is the ARMS program. And Brittany is the recovery coach there, and she works with people 26 and under. So that's the young people's, side of things. So those are the ways that other, I guess you could say, special populations can get access to a recovery coach. The state is working on licensing recovery coaches. Right now, we're certified recovery coaches, and the state has a bill that talks about licensing. It's kind of a split feelings around that, but if that does happen, then recovery coaches will be billed through, different health insurances.
And also the beauty of the team too, where one of my guys or girls and participants in Charlestown, with tragedy, there's triumph as well, but sometimes, people overdose, people get stabbed, people get shot, and then up in the emergency room, in the emergency department, and for me to be able to call Dan, or someone's doing a little better in IOP, to be able to reach out and call Donna and say, can you check on this guy, can you check on this girl, same thing, this guy just, is just overdosing, and he's alive, can you go check on him, Dan's right there, so it's that connection that we have when people are, we're all in different areas too, it's not exclusive to that area, it's nice when someone is there and you can, you're in the emergency room, I'll talk to me, get out, they get admitted, I can talk to Donna, I come visit them, now again, and, reach out to you as well, so it's a beautiful thing to have other coaches in other areas,
Yeah, for sure.
adolescents, all that, so.
Yeah.
Thank you. And we have a question. So it looks like we have some folks joining in today who are interested in obtaining their recovery coach license. Do you have any information on some ways to get observations hours for it?
To get the supervisory hours that are required, it's possible to volunteer your services at a peer support center is the quickest, easiest first thought that came to my head. There's typically going to be a recovery coach supervisor there on site that would be able to, sign off on the hours when you met that criteria. I don't know if anyone else has any other suggestions aside from getting it, working as a recovery coach, in which you would be obviously have a supervisor in that setting as well.
Yeah, and MGH here and across the system for MGB, people don't have to be certified recovery coaches. So there are no licensed recovery coaches, just certified recovery coaches. So we will hire somebody who's not completely certified, and then, myself or even Dan can sign off on their hours for the supervision piece and the working hours piece. You have to have 500 working hours, but that's also, like you said, volunteer hours. I think the easiest way is through a recovery center as well.
So what's the difference between certification and a license? Just a general
Well,
broad.
So generally, when recovery coaching started, it was never meant to really be in clinical settings. Now they're looking to, we have to go through the 5-day Recovery Coach Academy and take a host of other trainings as well to become certified. And then we have to have the 500 working hours, 35 supervision hours by somebody who is a supervisor of recovery coaches who's gone through that training. There is no licensing process right now, but like I said, through the state, there's a bill right now to license recovery coaches. And the reason why I said that there's a little bit of pushback from some recovery coaches is, this is a peer-to-peer intervention. And we don't want to, Ryan said it best earlier, we are here with people, we're patient-centered, person-centered. And, when you start to license people, it starts to change the hierarchy of things.
Mhm.
So there's a little bit of a pushback and feeling like we don't want to over professionalize recovery coaching and kind of keep fidelity to the model of that peer-to-peer. The magic, the magic is like when I walk into a room and when I was coaching and I said to somebody, me too, I've been here, I understand how you feel, I'm a person in recovery, that wall comes down. If I walk into a room and I say, I'm a licensed recovery coach.
It's the word license.
It's the word license. So I don't know if the bill is gonna go through, but some people are saying it will be good because then we can bill insurances. But I think we should be recognized regardless if we're licensed or certified because we've worked hard to get here.
Thank you. This next question is specifically for Dan. In the ED, have you seen more people come in due to the pandemic?
In the emergency department in general, absolutely, yes. A lot of people didn't have access to their outpatient providers, or they weren't comfortable going to their outpatient providers for things that typically you would see in a primary care office or an outpatient setting. So we're seeing an incredibly high volume of patients in the emergency department for reasons like that, as well as for substance use disorder. A lot of people may not have access to the resources to get themselves into treatment, and they know that we do here. So I think some people come in just to help with things that could be facilitated outside of the emergency department. And yeah, so there's an incredibly high volume of patients in general in the emergency department, and specifically with substance use disorder. I think a lot of people are hitting barriers to treatment, and we work diligently as a team in the emergency department to break through those barriers. As difficult as it is every day, we tend to get the job done.
Thank you. So while we'll give it a minute to see if anyone else has any questions, do you have any final thoughts you'd like to share with the audience today?
I just want to, just say that this has been, I've been with MGH in this position for almost a year now, and I've been with MGB, aka Partners, for almost 5 years. This week it'll be 5 years that I've been in different roles, and I really appreciate how much work and thoughtfulness goes into the recovery coach program, and how clinicians, social workers have, how they really see our life experience and our lived experiences as expertise, and they look to us for that expertise. I feel that a lot of clinicians, the on-site supervisors where everybody works really respects recovery coaching, and they look at us as professionals. So I've appreciated that in my 5 years here. In the future of recovery coaching, we're really working on looking at things from a diversity, equity, and inclusion lens, making sure that we are, reflecting the population that's in Boston. We continue to do trainings around diversity, equity, and inclusion. We have constant talk and dialogue about that. And, you know, it's just a really great experience working here, and it helps my recovery. It really does. It's, you know, if I know I have to come to work tomorrow, I'm not gonna pick up. I'm not gonna pick up. I love my job. I don't wanna, you know, I don't wanna do anything to jeopardize what I've built, you know, almost for 10 years. I don't wanna jeopardize, you know, my kids seeing me in that position or anything. So, this job, feeling respected, working with amazing colleagues. I mean, you all are amazing. You know, it just really keeps me on my toes.
There's no doubt we keep you on your toes with you. But thank you for your kind words. To echo what Wendy is saying, the amount of support we feel here, I feel here at MGH, it does. It makes you feel good. And yeah, I do feel like this role does help me in my recovery. I feel accountable, not so much to my workplace, because I love my job, but it's more so to the participants, people I'm supporting. I feel very accountable to them, and I wouldn't want to let them down, nor my family or my, you know, personal supports down. So yeah, I can definitely relate to that.
No, well, I got part of my own thing. That's fine.
Well, thank you.
Okay. Well, thank you so much, everyone, for your insightful stories, experiences. And everyone else, thank you so much for joining us today. As mentioned, if you're interested in viewing the recording of today's session, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the afternoon.